Welcome and thank you for watching our presentation. My name is Dr. Nikos Gerfield. I am the county veterinarian, and with me today is Dr. Saren Graywall, who is the chief of the Community Health Division. We will be discussing the vector control program and its benefit assessment for the next fiscal year. First, though, what is a vector? A vector is an animal like a mosquito, tick, or rodent that can spread diseases to people. The Vector Control Program, or VCP, works to protect people in all 18 incorporated cities and the unincorporated areas of San Diego County from these vectors and the infections they spread, like West Nile virus, dengue, plague, and many others. The program monitors and reduces vectors when necessary to protect public health and helps people learn how to stay safe from vectors and the diseases they transmit. We also respond to thousands of requests for service each year from the public at no additional charge. The VCP protects and prevents against vectors and vector-borne diseases by using an integrated vector management strategy, which uses several interconnected methods, including public education, surveillance and monitoring, disease diagnostics, and source reduction and treatment. When these components are used together, they prevent vectors and vector-borne diseases in the most effective, efficient, and environmentally sustainable way possible. As part of this integrated strategy, we teach and empower residents how to protect themselves from vectors and the diseases they transmit. This happens when our certified vector control technicians respond to public requests for assistance, when our trained outreach staff give and attend over 100 free educational presentations and community fairs throughout the county each year, and when we reach millions of residents through yearly multilingual educational media campaigns. We particularly focus on underserved communities so that they can take advantage of our many free services. This includes giving presentations and distributing materials in Spanish and other non-English languages, placing thousands of educational materials in community hubs and libraries in underserved communities, and specifically directing media campaign content to these communities. Our staff trap mosquitoes, ticks, and rodents throughout the county to monitor their levels, test them for diseases, and to guide our field operations to take swift actions to protect public health. Our technicians regularly inspect more than 1,600 sources of standing water throughout the county that are known to breed mosquitoes, and our in-house laboratory tests for over 20 diseases and vectors and is seen as a leader in the state for vector diagnostics and high-quality laboratory practices. The VCP offers free help to anyone in the county, including property owners, residents, and resource agencies, to find strategies that will reduce vectors, like mosquitoes and rats. One strategy we use is source reduction, which involves removing breeding sites and attractants for vectors. For example, since mosquitoes breed in standing water, finding ways to drain water, enhance water flow, and prevent further accumulations are very effective ways to reduce sources of mosquitoes. We also provide guidance to agencies and local governments for managing their wetlands to reduce or prevent mosquito breeding. Source treatment is another method used by the VCP to reduce mosquitoes that can transmit diseases to people. This includes providing free mosquito fish that eat mosquito larvae in standing water sources like artificial ponds and neglected swimming pools, or applying biological larvicides that specifically target mosquito larvae but are safe for people, pets, plants, and the environment. We regularly monitor over 1,600 mosquito breeding sites, many of which are treated by hand. Larger sources may be treated by truck or helicopter during the mosquito season. And we respond to reports of vector diseases throughout the year to make sure that they don't spread. As you can see, we have multiple treatment methods to choose from, and we will use a strategy that has the least impact to the environment while at the same time achieving the best results. This integrated approach enables us to respond to changing conditions and emerging vector threats, such as invasive Aedes aegypti mosquitoes. This mosquito was first detected in San Diego County in 2014 and has spread ever since. They love to bite people, breed in water at people's homes, and under the right conditions, they can spread diseases such as dengue, Zika, and chikungunya. In fact, last year, for the first time in California, Aedes aegypti was responsible for spreading dengue in LA County. The VCP works throughout the year, including after hours and on weekends, to prevent the spread of dengue and other diseases. We do this every time we are notified by our colleagues in public health that a case of a vector-borne disease is in the county. Because a rapid response is often critical, especially for Aedes aegypti transmitted diseases, after we are notified, we immediately analyze the situation and determine an appropriate response based on our strategic response plan. This includes numerous coordinated actions within the first hours and days of notification, including case interviews, trapping and testing mosquitoes that could spread disease, GIS mapping, activating phone lines to answer public questions 24/7, notifying the public and partner agencies, issuing press releases, and finally, treatments to suppress mosquitoes and prevent the possibility of disease transmission. Afterwards, there's continued monitoring of the area for several weeks. We train throughout the year to keep staff and equipment ready to respond. And since 2016, we have responded to over 530 travel-associated cases of dengue and Zika. And fortunately, no local spread of these diseases has occurred in the county.
The VCP positively impacts the county every year. For example, in 2023, the program's educational vector prevention media campaign was seen over 58 million times, and we gave out over 18,000 educational materials. We tested more than 21,000 mosquitoes, ticks, and rodents for different harmful diseases and completed over 5,000 vector-related responses to help the public. These are just some of the many services that the VCP performs every year to help county residents stay safe from vectors and vector-borne diseases. All this work is done in coordination with or in close partnership with a variety of different organizations throughout the county, including federal, state, and local land management agencies, local transit districts and airports, school districts, and other county departments. Funding for the VCP comes from two sources: service charge and benefit assessment. The service charge has been fixed since 1996 at $3 per parcel for the coastal region and $2.28 per parcel for the inland region per year. This service charge provided limited funding and was not sufficient for the level of mosquito and other vector control services needed. So in 2005, a new benefit assessment for improved vector control services was approved by San Diego County voters. A benefit assessment is a charge paid by property owners for a public service that provides special benefit to their property. This assessment was first levied in the fiscal year 2005-2006, beginning at a rate of $8.55 per family equivalent per year, and has continued at a certified rate thereafter. The program services supported by this benefit assessment are described in an annual engineer's report. The engineer's report is prepared and certified by an independent third-party engineer. It includes data about vector control services provided in the previous calendar year and describes the services and performance goals to be funded by the proposed benefit assessment for the coming fiscal year starting in July. The proposed benefit assessment rate reflects known costs as accurately as possible to continue to protect public health, deliver programs and services to customers and communities, make data-driven decisions, and continue community outreach and engagement. The current year's benefit assessment is $9.10 per year for a typical single-family home. Significant cost increases, most of which are out of our control, including salary and benefit costs, and impacts from increased facility and equipment charges, have affected our operating budget. However, our aggressive cost containment measures have helped to limit these pressures on our tax ratepayers and resulted in a proposed rate for a fiscal year of $10.76. This would be an increase of $1.66 per year for a typical single-family home. For perspective, the proposed rate is below most other vector control district rates throughout the state. The proposed rate helps positively support program resiliency and services, including additional mosquito control due to lingering impacts from the historic January 2024 rainstorms, and for disease prevention efforts. And as mentioned earlier, invasive Aedes disease prevention is more important than ever following California's first local transmission of dengue in LA County last year. Each year when calculating the proposed rate, vector control incorporates cost containment efforts and strategically utilizes trust fund savings to offset rates, which includes $2.1 million for the next fiscal year. Additionally, there are $328,000 in savings from program efficiencies and innovations. Examples of these efficiencies are from in-house 3D printing of equipment parts, the use of more efficient rechargeable batteries in surveillance traps to monitor mosquito levels throughout the region, efficiencies in mosquito fish production, mosquito treatment equipment that saves significant staff time to set up, and lab efficiencies, which not only saves staff time, but also reduces the amount of plastic waste. The trust fund savings use plus efficiencies total over $2.4 million, which is incorporated into the $10.76 proposed rate for the next fiscal year. So what's next? The proposed new benefit assessment rate, as well as the continuation of the service charge, will be reviewed at the Board of Supervisors meeting anticipated in June. If the board approves the continuation of the assessments, they will be included and collected with property tax bills. The engineer's report supporting the calculate rate will be made available for anyone to read at sdvector.com. The VCP is always working to improve the effectiveness and efficiency of our program. The program is continuing its work to respond to invasive Aedes mosquitoes to prevent transmission of diseases within San Diego County. We're continuing to work on an initiative to ensure greater accessibility to vector control services by translating materials into new languages and forming new community partnerships to reach more people throughout the county, especially those in underserved communities. The program is also continuing to innovate. It is currently working on developing 3D printing capabilities and new lab tests, and possibly incorporating drones into our surveillance and treatment protocols. These new and enhanced tools will help VCP to achieve its goals of protecting the public from vectors and vector-borne diseases and safeguarding public health. Thank you for watching this video. For more information about our program, you can visit our website at sdvector.com and follow us on Facebook and X at SDFightTheBite.